EECA region countries, and during this meeting we are going to have 3 interactive sessions where you will be able to speak up and discuss the issues that are relevant for you, share your experience and ask questions to the speakers. You can also write down your questions into the chat and we will definitely answer those. But before we start with the presentation, I would like to give the floor to the Executive Director of TBEC, Yulia Kalanchak, please. Thank you very much, Lisa. Dear colleagues, do you hear me well? More or less. Okay, so dear colleagues, dear friends, I'm really glad to welcome you at today's meeting. And this meeting is dedicated to one of the most important topics, the results of CLM on implementation of the standardized package of community-based support services and procurement of shorter TB treatment regimens. We all know that community-led monitoring is not just a control tool, it's a strong tool to achieve change. And when we jointly assess the real situation in the countries, we not just build the transparency and trust, but we also bring foundation for sustainable advocacy. So that's a great opportunity to prove that participation of CLM is the key to long-standing meaningful results in TB response. We must note that this event has been made possible by active involvement of all the countries, NGOs, CSOs, national TB programs, and the community-based organizations and civil society organizations have shown that they are not just the voice of the change, but also the driver of the change. And the national programs have become our reliable partners, supporting the changes which make healthcare systems more accessible and more effective. So the results of the 2 monitoring exercises that we will discuss today, they underscore the importance of comprehensive approach that is implementing the people-centered approach in treatment and access to short treatment regimens, which really change the quality of life and increase the performance of TB programs. So joint efforts of Azerbaijan, Moldova, Belarus, Tajikistan, and Ukraine have allowed us to get very important data that will be the basis for our future actions. And today's webinar is not just a platform to share the experience and knowledge, but also an opportunity to get closer to each other, identify the key challenges and the ways to resolve those. So thank you very much for your involvement. Let us start our work. Thank you. Thank you very much, Yulia, for this inspirational speech. And let me remind to the participants who have just joined us, we have the interpretation function English, Russian, and Ukrainian, but Ukrainian is called French for today's session. So please choose the one you prefer. Dear participants, dear speakers, before we switch to the first presentation, we suggest that you turn on your cameras and so that we could make a picture. Okay, dear colleagues, please let me know when the photo is made. Please stop sharing the screen so that we could make a good photo. It may take a little bit of time because we have a lot of participants, which is, of course, good. Okay, thank you, dear colleagues. It has been a pleasure to see you all. Please, if you can keep your cameras on, and we will continue. We will, of course, share the photos at our resources, but now a small announcement about how you can watch the presentation in the language of your choice. For that, you need to select on the top panel on the right the field called shared screens to view the presentations in Russian. Choose the presentation in Russian, in English, presentation in English, and in Ukrainian, the screen called Презентація українською. So the detailed information can be found in the chat, but if you encounter any questions, technical questions, please write those into the chat and we will promptly respond. We also ask all the participants do not share your own screens because your desktop will be seen to other colleagues, and please do not turn on the mic when the speaker is speaking. Also, do not change anything on the screen you view. And after we have done everything we needed with logistics, I'm giving the floor to Bakyt Myrzaliev, who will share the results of the CLM in the four regional countries regarding the implementation of the standardized package of community-based support services and shorter TB treatment regimens. And though we had 10 partners, well, we cannot listen to everyone this time, but we will have only 2 speakers. But during our interactive sessions, you will be able to ask the questions to the participants representing the countries. Bakyt, please. Yes, dear colleagues. First of all, I would like to say thanks to the TB Europe Coalition for the opportunity to work with the colleagues Aleksandra Vasylenko, Sharman Fushadov, and Oleg Klimenko on this report. The next slide, please.
Next slide. Целью нашей работы было оценить эффективность
of our work was to assess the effectiveness and identify challenges in procurement of TB drugs in Kyrgyz Republic, the Republic of Moldova, the Republic of Tajikistan, and Ukraine in 2022-2023. For that, we set the following objectives: to assess the epidemiological situation in the countries, examine the regulatory framework for TB treatment and procurement, monitor government procurement, identify barriers and risks, and develop recommendations based on those identified barriers and risks. Thank you. Next slide. For that, we have analyzed the following blocks: epidemiology, legislation, monitoring, and procurement. Next slide. We also identified a separate methodology. And the main chapters were to identify a number of key criteria for the planned monitoring, review the country's legislation regulating implementation of TB treatment programs, examine existing international programs and projects for TB drugs procurement, review the country's legislation regulating procurement mechanisms, monitoring of public procurement itself, and final analysis. Next slide, please. Epidemiology. Now, long-term consequences of the COVID pandemic have affected healthcare systems in all the countries. And sometimes it has led to the drop of newly found cases of tuberculosis by 30%. Now we see partially recover of that number, but it is still an issue. We need additional efforts for early detection and treatment of tuberculosis. All the countries show significant improvement of molecular testing, such as GeneXpert, and access to new shorter treatment regimens, such as BIPAL. These measures improve the accuracy of diagnosis and improved treatment of both tuberculosis. In the Kyrgyz Republic and Tajikistan, we see a significant reduction of MDR and XDR TB because of implementation It is important to continue those efforts and expand the access to the new treatments in other countries. In Kyrgyzstan and Moldova, we see the increased incidence of tuberculosis among teenagers, but we need more prevention and more early detection programs for the youth. We need to pay special attention to remove the barriers to access healthcare for group. In Ukraine, because of the military conflict, we see the increase of the incidence of tuberculosis because of decrease in the access to treatment, prevention, migration, and other problems. So that means new programs are needed to overcome those problems. In all the 4 countries, we need further monitoring of epidemiological situations for timely correction of the response, involvement of civil society and private medical health service providers to improve the treatment and support. The sharing of the experience between the countries may help them to better respond to the challenges and improve the performance in treatment. The next slide, please. Kyrgyz Republic actively updates legislation and cooperation with international partners to improve accessibility and quality of TB drugs. In the Republic of Moldova, they implement clinical protocols, insurance, and free treatment programs with a special focus on drug-resistant tuberculosis. In Tajikistan, there are certain problems with updating the legislation, lack of increased market authorization, speedy market authorization of the medications and procurement procedures. They limit access to TB drugs, especially for DRTB. Donor support is now covering the needs, but we need to increase the public funding. In Ukraine, despite the international support and good legislation basis for procurement, there are still short-term drug shortages, which requires strengthening the control and improved forecasting as a part of the national programs. The next slide, please. Review of national recommendations. All the 4 countries have been successfully integrating international WHO recommendations into their national guidelines and protocols, ensuring effective and safe treatment of tuberculosis. In the Republic of Tajikistan, the guidelines have been updated to reflect the latest WHO recommendations and submitted to the Ministry of Health for approval. In other countries, they have also updated the guidelines according to the WHO recommendations, and they have been approved by the respective agencies. Also, BPAL and BPAL regimens are the first regimens of choice for people resistant to fluoroquinolones. Also, a modified WHO recommended short DRTB regimen is being implemented. The next slide, please. The main aspects of procurement. In 4 countries, we see the procurement through the GDF. Also, USAID helps, especially in Ukraine and Tajikistan.
Countries also hugely depend on international donors for procurement of the second line drugs. All the drugs procured are pre-qualified by WHO, guaranteeing their quality. However, there have been purchases without qualification when countries faced shortages, for instance, in Ukraine, or had weak regulations in Tajikistan. New treatment regimens have been launched in Kyrgyzstan, Moldova, and Tajikistan, and the countries are implementing new regimens, for instance, in Tajikistan, and stream enzymes have been implemented in Moldova to treat drug-resistant TB. Next slide, please. All the countries, except for some, specifically Moldova received funding from external funders. Ukraine, starting from 2022, totally depends on donors for purchasing, especially internationally produced TB drugs. And in order to ensure sustainability of TB programs, we need to strengthen the national health systems, reduce dependence on donors, and integrate new treatment regimens that would ensure sustained supply and procurement of drugs even in crises. So next slide, please. This slide actually shows the number of registrants in the countries. You can see that most of them are from India, in Kyrgyzstan, 59%, in Moldova, 35%, and in Ukraine, about 40%. They are followed by Russia in Kyrgyzstan with 12%. In Moldova and Ukraine, they're followed by Ukrainian producers. Tajikistan has registered only Pretamanate by Mylan, Linezolid by Lupin, and levofloxacin, moxifloxacin, bedaquiline, clozapamine, and pyrazanamide by Macleo, and they are awaiting the registration certificates and registration in this country. Next slide, please. All the countries that were included in the study, TB drugs procurement is covered by laws and regulations that regulate the procurement process, quality, and distribution of the drugs. In most of the cases, the responsible agencies actually take charge for centralized procurement to ensure transparency and accountability for public spending. Some countries still have some problems with registration, limiting the access to the national markets for these drugs. Also, there are some countries that have some unregistered drugs used that require special permits for import and distribution. So this table actually shows registered drugs in green. Red stands for non-registered drugs, and yellow stands for the drugs for which the registration is still pending. Quite notable that most of the countries have registered most of the drugs, but pay attention to Tajikistan. So they have partners for the USAID funded projects, and they have rifampicin, for instance, registered, whereas in the three other countries, this drug combined with, some drugs combined with rifampicin are not registered. And in Moldova, for instance, we have the registration for bedaquiline still pending, but it is very important to have it registered because it's part of the BPAL regimen. In most of the countries, international donors, specifically USAID, play a huge role in the procurement, specifically procurement of TB drugs. And actually, most countries, they procure the drugs using international funding. In Tajikistan, they have some shortage of funding. That's why the sufficient amounts of drugs are not procured. Kyrgyzstan depends hugely on donor funding as well. In Moldova, there are some attempts to procure drugs using public funds from the budget. So we need to further strengthen national procurement mechanisms in the countries, increase domestic funding, and accelerate registration of drugs for short DRTB treatment regimens. Next slide, please.
Next slide, please. Мониторинг государственных закупок.
Public procurement monitoring. So Kyrgyzstan has demonstrated centralized procurement of TB drugs at the national level. In 2022-23, they increased procurement of different TB drugs, especially in 2023, but they still have some dependence on local suppliers that might limit competition and result in high prices. Moldova has a better institutionalized and yet centralized process. They use transparent mechanisms. They use a centralized tendering process for procurement of TB drugs, and they have a decreased proportion of injectable drugs for TB as a share of procurement. And in recent years, they have increased the budget for short-term regimens and increased proportion of newer drugs, bedaquiline, delamanate, that actually is in compliance with contemporary guidelines. In Tajikistan, we can see lack of public funding. The procurement is mainly from the Global Fund money via UNDP. And national funding, domestic funding, is insufficient, especially for drugs to treat DR, TB. And there are also delayed attempts to update the regulatory framework, limiting access to WHO pre-qualified drugs. In Ukraine, because of the war, in 2022-23, all the procurement was made using the finances from donors, and the procurement is made through the public health center that actually limits the opportunity for planning and monitoring. Next slide, please. So here you can see the procurement prices by country, and compared to 2020, yes, actually this is a comparison between 2022 and 2023. And the red arrows indicate increased prices, the green ones indicate the decreased prices. So you can see the prices for bedaquiline in Kyrgyzstan 2022 and 2020 was same years Tajikistan and Ukraine. And we can see that, for instance, in Moldova, the prices for bedaquiline are increasing. For Pritomanit, we can see decreasing prices, but in Tajikistan, yes, and Moldova first purchased Pritomanit in 2022, but as I mentioned before, 80% of the TB patients with DR TB have started short-term regimens. And in Ukraine, actually the prices stay the same. For linezolid in Moldova, we have actually a very high increase in prices. In all the other countries, it stays the same. And as for moxifloxacin, we can see a serious increase in the prices in Kyrgyzstan. Next slide, please. As we are switching between slides, please mind the interpretation and don't rush forward so quick because they need to interpret. Okay, just I was told I had only 25 minutes, so I'm trying my best to squeeze the presentation within this time frame. And here we can see also by countries the purchased volumes. And we can see that in Ukraine, it has actually doubled. At the same time, in Kyrgyzstan, the purchases of bedaquiline have decreased. In Moldova and Tajikistan, it stays the same, more or less. And in Tajikistan, it has even a bit decreased. Now about Pritomanit. Overall, in Kyrgyzstan and in Ukraine, we can see reduced purchases and they actually started procuring predominate in 2023. Now about linezolid, Kyrgyzstan, Moldova, and Tajikistan had some volumes of linezolid in stock. That's why they did not purchase it in 2022. And we can see a huge increase on the volumes of linezolid purchased in Ukraine. And for moxifloxacin, we have an increase in Ukraine and a small increase in Kyrgyzstan, though they did not previously purchase it because they had it in stock as well. Next slide, please. So now some statistics on people eligible for short-term treatment regimens. We know that today in Kyrgyzstan, Moldova, Tajikistan, and Ukraine, there are certain specifics, country specifics. Kyrgyzstan, Tajikistan, and Ukraine started implementation of short-term treatments actually very quickly after WHO recommended them, specifically BPAL. Moldova somewhat lagged behind because they were preparing the legislation for that. And so they did not start short-term regimens in 2022. But if we look at Moldova today, we can see that already in 2023, 80% of MDR patients or XDR patients already enrolled on treatments, on shorter treatments. So actually, almost all of them are already covered. Whereas, for instance, in other countries, the first year they prepared some recommendations, then they started the implementation, but they are now lagging behind the enrollment rates, so the coverage. They are somewhat slow. For instance, in our country, we have still about 252 patients eligible for BPAL in Kyrgyzstan that are not yet enrolled. The same situation is in Tajikistan. So Stop TB Partnership implemented a project there, providing access to short-term treatment courses, but the enrollment is very slow. Still, in Ukraine, actually, they purchased the maximum volume of drugs the very first year, but again, they have a lot of patients eligible for the treatment. That's why, as it stands now, another 16 plus 100 people in 2023 could be eligible for short TB treatment regimens, but have not enrolled. Next slide. So, as a conclusion, we can say that countries have made good progress with the initiation of short-term regimens, yet to increase adherence to TB treatment and achieve treatment outcome targets and ensure rational use of financial resources, it is recommended to finalize and update registration of all TB drugs and approve updated standards for DR-TB treatment, start and expand procurement of short-term treatment regimens based on BPAL funded from the national budgets, increase the proportion of patients treated with short-term regimens, continue third-party community monitoring for unbiased evaluation of the current situation, introduce an indicator to the global TB report reflecting the number of people on short-term treatment in the countries to have a bigger picture. Because today we know that these countries have the access to this short-term treatment, yet they are at different stages of implementing these regimens. But we know that some less developed countries do not even have access to short-term regimens. Next slide, please. And some acknowledgements. I just want
I would like to say thanks to
express my appreciation to the Ministry of Health,
and the
national TB
of the
programs
Kyrgyz Republic,
of Kyrgyzstan,
Moldova,
Tajikistan, and
for their
Ukraine
cooperation in obtaining
for their cooperation in obtaining data and for their support. And also, we want to thank our EECA ITPC partners, specifically Denis Godlevsky, Alexei Mikhailov, and Ekaterina Novikova, who have provided invaluable support from the very beginning of our discussions to the finalization of the report. That's it. Next slide. Just thank you. So thank you for your attention.
Thank you very much for being so timely for this good presentation, where you discussed in detail the results of the monitoring, and I'm pleased to start our first interactive session of questions and answers. And while all the colleagues, all the participants are getting ready their questions, I would like to remind you that we have Ukrainian, English, and Russian interpretation. Ukrainian is called French here, but it is still Ukrainian. The Ukrainian interpretation is available thanks to the support from the Stop TB Partnership Ukraine, the secretariat of which is Convictus Ukraine. So, dear colleagues, please ask your questions. You can raise your hands so we could see you, and then ask your questions. Or you can write your questions into the chat. So while the colleagues are brewing their questions, I think I can give the floor to the participating countries that have taken part in this monitoring. Maybe they would like to add something on their behalf. Because we definitely have people from Ukraine and Tajikistan here. Great. Then let me ask a question that I have. What were the challenges that you encountered while doing the monitoring? Because we all know that when you do monitoring, community-led monitoring, one way or another, we encounter some problems, some difficulties. Maybe you would like to share with us what those challenges were and how you managed them.
Yes, we
can start with you, Bakyt, I think. Yes, I have taken part in collecting data on Kyrgyzstan. Well, despite the fact that there were some situations when we had to leverage the NTP to access other government bodies, because only NTP received the letter, the formal letter, and the NTP subordinated to the Ministry of Health. And through the program, we were able to get to the procurement program, and then we got additional data requests through them. And since day one, we got very good loyalty from the national program. They were committed and provided good data on epidemiology, on incidents. And when preparing the final report, there was a point when some countries corrected the data on the go. And when we disseminated the final version, they basically updated the whole list, and that also took some time to incorporate the changes. But it was a pleasure to work with the colleagues. They provided data on a timely basis. Oleg Klimenko from Ukraine, Oksana Rukshinya, Sermon Khurshadov, and Oksana had some questions that required more help. And it took some sessions to explain that we are not trying to criticize or blame someone. We are not trying to punish anyone. We are not doing anything bad. We just make conclusions and provide recommendations. We have discussions. And when the NTP program people, they understood our purpose, then they were more cooperative. Thank you very much, Bakyt, and I would like to encourage the participating countries to say a few words. We have Oleg Klimenko here from Ukraine. We have Shadmon from Tajikistan. Maybe you would add something to what has already been said through this presentation and to the challenges that you encountered while doing the monitoring. Okay, so it's all covered then, and we are done. Thank you very much, Bakyt, and we're switching to the next presentation, which will be presented by Mikhail Volik, and I would like to give the floor to Mikhail, who will share with us the results of the CLM and on implementation of the standardized package of support services, community-based services in 6 countries of the EECA region. Please, Mikhail, the floor is yours. Yes, good morning to you, dear colleagues, Lesia, friends. It's still summer in Tashkent, and today is a great holiday, Thanksgiving Day. Some people celebrate it. Well, good for you. That's a great day when the families get together and just spend a good time. So I am pleased to present the results of the community-led monitoring. That's now analysis supporting this work and doing their best to bring the attention of everyone to this topic. So that we are going to talk about analysis, about the observation that we had and main conclusions. Maybe you will disagree on some points. We will be happy to see your questions and the recommendations. Well, basically, we provide recommendations based on what we observed. As you know, this study was conducted in our region, and its basis was the story about the gradual implementation of increasingly more supportive auxiliary services, because we all understand really well that medications are important, diagnosis is important, and I'd like to say thanks to Bakyt and the previous team for paying attention to shorter regimens. That's actually good that those regimens are in the focus now, because it all leads to the situations where our patients they show more adherence to treatment, and they get better results, and the quality of life is improving. But at the same time, we understand that just medications are not sufficient, because there are many other barriers and problems that may preclude people affected by tuberculosis from seeking medical aid in a timely manner. Then they may be not adherent because, like, you understand, there are adverse effects. And even when we reduce the length of the regimen, or we have fewer drugs in this regimen, but there are still many adverse effects, and there are many other adverse conditions. A lot of things that need to be done to achieve positive result of the treatment, which is either when the person is cured or the treatment course is completed, at least all the doses have been taken. So, well, we have known about that for some time, and it is clear that we need to provide help, first of all, aiming at people with the confirmed tuberculosis diagnosis, and to support their adherence to treatment and help them complete the treatment course. So this idea has evolved, and it is great to see that it is in the European region with the support of the TBEC, together with the PASS Center from Moldova, the WHO Europe Regional Office. We now have the standardized package of supportive services to improve the results of treatment and prevention of tuberculosis. So that's a lengthy name of this package, but it reflects well the idea behind this document, behind this concept. So if you are not yet aware about this document, it's available in Russian and English, or maybe you don't know a lot about it. Read it, learn more, because standardization has helped to complete the healthcare services, producing more comprehensive approach to the service provision, and we go beyond the treatment cascade, treatment trajectory when a person is already having TB, and then healthcare system tries to treat the person to bring him to good results. But that's a broader concept. It includes 12 services, and the document itself includes the methodology for calculation, and the countries that work with that know about it well. And on the next slide, let us check. These 12 services are listed. The services that are used not just and to a less extent for people with tuberculosis who are receiving treatment, but it's about the general understanding of the TB response and the related services, which includes the awareness raising, like creating the favorable environment for TB response, and counseling people at risk of tuberculosis, those who do not have yet have it. And this is a whole category of people who have got active tuberculosis excluded, but they may have latent tuberculosis. Well, and they need preventive treatment of tuberculosis. Of course, a lot of these services are focused on people who already have active tuberculosis, who need medical treatment, but we also would like to draw attention to the fact that it goes beyond that when the treatment is already over, and now increasingly more discussion concerns post-tuberculosis period when the treatment has been completed, but people still need help, and this help is often not clinical, but it's sort of supportive, social support or rehabilitation. Next slide, please.
And now about the purpose of our study, our analysis, it was actually to understand, next slide please, to understand what was the current level of implementing the standardized package, because we tried to understand how coordination is done between different agencies, governmental and non-governmental agencies, or the public sector. Also, we are trying to evaluate introduction of new funding mechanisms. Actually, they're already there, specifically the so-called social contracting, also investments in staff training and development and implementation of a new monitoring and evaluation system, because we always want to know how efficient and effective all our activities or attempts are, and whether the investments have been cost effective, have been really efficient, or need maybe to be adjusted or revisited. Next slide. So, as we looked at the indicators, we knew that the WHO new regional action plan for Europe, there are already 4 proposed indicators, and we know them really well. But again, if we take only these 4 indicators, it will be extremely difficult to evaluate the implementation process, because you know that we have 12 services listed, and these indicators only relate to 2 of them, like the proportion of people with TB found through active case finding by SCOs, and proportion of people with TB who started TB treatment and received any form of treatment adherence support from CSOs. So, yeah, as it stands now, countries have some difficulties to actually take track of data for these indicators. So we need to think how we can actually contribute to this system, to add some indicators to better understand what is going on in our countries. So this set of 4 indicators only does not permit a comprehensive assessment or routine collection collecting best practices. In 6 countries, some piloting was made: Azerbaijan, Belarus, Kyrgyzstan, Moldova, Tajikistan, and Ukraine. So we had a team of national experts, and we are extremely grateful to those experts. And we also had support from international consultants and technical support from the TB coalition. And again, we had a number of tasks and objectives. First of all, we needed to analyze the current level of the service provision and the progress achieved, major achievements in implementing the standardized package at the community level in all these countries. We also wanted to know the barriers and whether those barriers were unique or common for these countries. We wanted to know the procedures used for monitoring and evaluation, and we wanted to get some lessons learned from countries, just to share this with some other countries to improve delivery of the services, especially for those countries that are just starting on the way towards implementing the package or have provided some social services so far. Next slide, please. So our further objectives were to analyze the findings, develop realistic recommendations, and draft a report. And the report will be ready quite soon. You will have a chance to get to know it, and our colleagues from TBEC will be later sharing as to when we can expect this report to be published and posted on the coalition's website. Next slide, please. So a couple of words about the materials and methods that we used. First of all, our study was more of a quantitative nature because most countries are now making their first steps just to implement the services, to say nothing of their evaluation. That's why we could not, of course, use the comprehensive sets of potential tools that are out there. And frankly, this is related to quality management assessments and evaluation. And it's actually a huge direction of activities. Also, under WHO, they have a separate dedicated department to evaluate the quality of health management. And of course, we use their guidelines, their data, and we also try to use a hybrid design, desktop review. We had a special tool for that. We were trying to understand what the national strategic plans for TB or national policies actually speak, or how they refer to the standardized package of community services, social services. And again, we tried to study documents that regulate the activities of NGOs and CSOs and social contracting with this. We studied the documents on external funding. We studied reports, publications, also publications in peer-reviewed journals, if any. But of course, there are limited numbers of these publications, even internationally. We also conducted semi-structured interviews with some people who agreed to participate and share. And we use data collecting using apps that are currently used for CLM. So this is a common tool that is used in many countries. It's called One Impact. And so huge thanks to the organization that is already using Impact, implementing Impact, because we could see that this is really a very high quality tool, actually permitting very fast and high quality feedback. And as I start speaking on the next slide, you will see who we interviewed actually. Primarily, these are governmental institutions, non-governmental organizations, independent experts, international experts. Next slide, please. And so we also had a category called unaffiliated or independent persons or other, but actually we had 0 respondents from this other category. We talked to, we didn't actually have a lot of responses from patients because we only could use this One Impact tool for that, but hopefully in the future we will have a wider use of this tool to get the actual feedback from the beneficiaries or the people that we are implementing these programs for. And we also try to understand which stages of this implementation of the standardized package our respondents participate in. So, and they reported, some of them, most of them reported that they participate, they are in the phase of adaptation and drafting of national guidelines, actually more than half of them. Also, 9 respondents reported training and supervision. Piloting was like 14 participants reported it, program implementation and scaling up, and provision of financial support. And by the way, it was great to see that quite a few participants reported that they already participate in monitoring and evaluation. in some of the countries. So that means that they are really serious on the implementation. Next slide, please. So next slide. One more. Next one, please. Yes. Thank you. So actually, this is our analysis of the current status quo and scope of services included in national packages in the countries. So we try to just evaluate, analyze the data that we collected, and in the alphabetical order, you can see the countries here, their current status, whether they have already developed and adapted to the standardized package, and if the package has been already approved, because approval, of course, is a prerequisite for funding as well. So it's very important that the package would be made legitimate or would be approved by a certain official document. And we can see that most of the countries have already approved the package. In Azerbaijan, it has been developed, yet not approved, but the approval is just pending over this weeks or days. And the same situation is in Moldova, but actually, there is a special agency for supervision over operational services, and they actually keep an eye on it, and they have developed a document actually describing every single step for this implementation of this standardized packages. So it's a unique situation, I would say, in Moldova, because they have not yet approved the package, yet they have a guideline detailing the implementation process, and it is already being used. And Tajikistan is also unique because it was one of the first countries that introduced the national package of TB support services, all the 12 services, and they approved it in 2021. Though, of course, we do understand that this existence of this document does not mean that all these 12 services are available to the beneficiaries, because there are some other considerations such as funding, some conditions for implementation, etc. Next slide, please. Next slide. Because next slide shows some observations. All the countries that were part of this study today have some adapted practices in place for provision of a wide range of community support services to people with tuberculosis. Again, these are primarily the services targeted at enhancing treatment, and these practices actually have gradually transformed into national packages. Also, actually, the publication of the standardized package of services in 2021 facilitated the process for the countries, and now this process actually covers the governmental as well as non-governmental institutions. They were hugely involved for consultations, and as a result, there was an understanding of what kind of services were necessary and how these need to be supported. Next slide, please.
And when we speak about the provision of quality services, well, we expect that the access to this testing and treatment recommended by the WHO will be provided for all patients in every region. Of course, there may be some problems, for example, with the access because of geographical remoteness. At the same time, well, obviously, we tried to assess the situation with this geographical accessibility, but well, it wasn't easy. But first of all, there can be some geographical limitations caused, first of all, by the fact that for these purposes, services to work, we need trained and prepared community members or NGOs that can take part, often meet the criteria, because there are criteria for eligibility to take part with the social contract, but it doesn't always work like that. And if in the region, in some region, there is no prepared and trained NGO, they will not have access to such a service. There is also this element of various projects, and historically it has happened so that a lot of supportive services have been provided with external donor support, support from the Global Fund or some project implemented by USAID. Of course, that's good, but very often we see this difference between the services and the range of services and the quality and the prices of services provided with the financial support from different donors. They may vary, and that may lead to, well, a service being not the same, or access to service not being the same. Next slide, please. Also, there may be some limitations caused by the choice of target audiences. It's like when we shaped the guaranteed package of healthcare services, which is the basis of the medical insurance system. You provide all people at once. At the same time, there are priorities, and for social contract, it's the same. There is some budget, there is prioritization, and people with tuberculosis lost for observation, or only people treatment at risk of interruption. And people who do not meet those criteria, for example, they are not included in the group of beneficiaries through the standardized package. And in the Global Fund programs, the support is only provided to people with DRTB, because this is the goal of the grant. And a lot of countries say that the DRTB is the biggest problem and the biggest module. Is, if you know how the applications to the GF grants are formed, there are certain priority modules for which they have targeted funding. And for example, if the people have some DSTB, then they are not included in the number of beneficiaries. On the next slide, we see and we can say that it was important for all the countries to formally approve the standardized package of services and to develop the pricing. They need to revise legislation. Very often it's caused by the fact that new definitions are introduced, old definitions are revised. They need to be aligned with new national policies and guidelines, which leads to expense of the state. And also we need to monitor the use of public funding. That's an important stage, and it takes some time. And the countries that say that the package has been developed but not yet approved, they are actually revising their legislation and bylaws in order to be able to implement the package in the routine practice. Next slide. And here we are going to speak about the monitoring and evaluation tools. We are speaking about the monitoring and evaluation of the services, and this question is asked very often by the state to assess the progress of implementation in the countries. They use the same systems that were created and are supported by the national programs. It is very good to see that many countries implement basically all the NTBs, all the national strategic plans mention the need to engage CSOs and CBOs. And that can be explained by the fact that there are recommendations about how to develop the national strategic plans, the recommendations from the WHO, and that's another factor that determines whether there will be funding from external donors. Nevertheless, we see that the countries try to meet this indicator according to the NSP, and well, including such indicators is important, and meeting the targets for indicators according to the projects. It's a sort of parallel system, but they are being integrated now. There are monitoring visits, there are internal and external evaluation tools, and it is good to see that they also use CLM and customer satisfaction evaluation too. And so, yeah, despite the fact that we don't have sort of opinions from the final end beneficiaries, we can still see these levels of satisfaction through the monitoring tools. Next slide, please. Here, we are speaking about the fact that some of the countries have already included the indicators recommended in the in the international regional plan of TB response. In particular, we have the examples of Moldova, where they have included 3 indicators in the NTP performance indicators, and those are reflected in the annual report of the program. But there are still questions about what targets can be set. Because, for example, the share of people with TB identified through active screening with the support of CBOs in 2021 it's 10.9%, in 2022 7.3%. But there should be a system, and we don't know what the target should be. So we are more of documenting the process that is ongoing of the standardized package to have a better understanding of the situation, and then to set some targets and plan our investments accordingly. But we see that the countries now can do that, and they are starting this work. There is a separate question about how important it is to train the human resources to implement the standardized package and how it's done. But here, of course, we understand that's a general feedback from the countries, that provision of such services at the level of communities requires knowledge, competencies, and if we look at the package itself, that's how it's built. It's a number of procedures and standards that need to be met so that the service could be considered provided and the quality of it is assured. But in healthcare systems of our region, these competencies are not well defined, and very often we don't have any institutes that train non-medical staff that provides these services. Mostly now this work is done by the projects and programs implemented through grants or some local level initiatives, but there is no centralized systemic work, and that's probably one of the biggest gaps and barriers that we see now, something that we need to think of how we address it. At the same time, even though we speak about tuberculosis here only, that there are many other social problems and healthcare problems where involvement of the civil society is considered important. We can speak, for example, about the HIV prevention and response, AIDS service organizations, where there are many organizations and outreach workers. And if we look at them, then the demand for personal training, I mean, training of non-medical personnel is high. But as the programs are somewhat isolated, and quite often it's caused by the fact that the support was initially through some particular grants or donor projects, then probably we need to think about more systemic approach, and probably the multi-sectoral accountability framework, which involves many sectors, many agencies, could be of use here, because the training facilities that can provide help here, and well, they should be involved. And if we speak about the standardized package, the TBEC has been able to produce online course that is available at the WHO platform. Open WHO is the name. You can take course there, and it is now available, as far as I know, in English, but probably very soon it will be published in Russian and some other languages. So I think that here some preparation work has been completed, so that the people could be referred to this training course. That's a very respected training course, and it's a good thing to have. Next slide, please. Here we'll be speaking about some mechanisms of funding. Well, initially it was about funding of all the supportive projects for people with tuberculosis from external sources. But gradually the country started implementing the domestic funding mechanisms. First of all, the state social contracting, and we see that it has been leading to gradual increase of the share of domestic funding. Next slide. Here we are going to speak about the sources and mechanisms, comparing internal and external ones. We see that basically all the countries now have the legal mechanisms to provide for grants and transition of grant funds, and basically everywhere easy to get a social contract from the state. It's not so easy to complete the contract, and it's even harder to report on it. So well, we know that there is room for improvement, and that's probably is going to be studied in our further research, how to support these projects. But again, I must underscore that there are opportunities for external funding, and it is really great because it allows for the diversification of the funding and supporting some services that are still going without good support, and there is no opportunity to provide funding for them.
And here, next slide, please. Next slide shows actually two examples of sources of funding in Azerbaijan. It's the Agency for State Support of NGOs, and we can see some increased amount of money already allocated for the next year, and supporting implementation of projects in the country, and we can see the amounts, and we can see an apparent increasing trends in allocation of money. Well, maybe it's not huge, but it's quite sustained. Next slide, please. So these are examples of best practices that we ask the countries to share about what they believe is most interesting, most important, And every country, and by the way, you know, we actually offered a set of practices for them to choose. And then the teams decided that for Azerbaijan, it was support to ex-prisoners with DRTB after release. For Belarus, it's the digest on the fulfillment of the social contracts that is issued monthly, and they aggregate and analyze the information on social contracting. In Kyrgyzstan, it's identification and re-enrollment of patients with TB that are lost to follow up. Again, as part of social contracts in Moldova, it's integration of community-based services into the national insurance system. In Tajikistan, it's the use of community-led monitoring findings for further decision-making, which is actually the ultimate goal of this monitoring. And in Ukraine, it's creation of safe spaces for children and adolescents with tuberculosis, also a very interesting example shared by TB People Ukraine. And next slide, please. Here I want to discuss the 8 recommendations that we actually drafted very quickly. So countries need to standardize and provide a full range of the services because this set of services actually is a well thought project, needs based. Also, we need to enhance promotion of the standardized package of community-based support services among the communities themselves. Recommendation 3, strengthen efforts to rapidly develop and operationalize monitoring and evaluation systems for the implementation of the national packages, because we need to know how efficient the implementation of these national packages is and what needs to be adjusted. Recommendation 4 is establish an ongoing certified training program for the staff involved in the provision of these services that are part of the national package, and this should serve the development of national competencies. It should be a program that, of course, needs to be certified and provided by the public sector. Next slide, please. So the recommendation 5, no, the previous one. Recommendation 5 is to do awareness raising so that people would better understand how they can use the resources of the package and how it could really benefit their work. Then we need to develop and implement some motivation programs for people involved in the provision of the services to improve treatment outcomes. Recommendation 7 is increase funding and diversify the sources of funding for the provision of the services. And recommendation 8, which is last but not the least, conduct research to study the impact of support services on the effectiveness of TB care and quality of life, as well as on the goals and objectives of national TB programs. Well, that's actually it. I'm done with my presentation, and I just wanted to thank all our national consultants who helped collect and analyze the data. And we also have drafted impressive reports for each country. And I also want to thank our colleagues from the TB Europe Coalition for their constant support and assistance. Also, thanks to our experts, respondents, and the management of the national TB programs in the countries where the study was conducted, who kindly shared their experience and vision. Next slide, please. So thank you all for your attention. I'm happy to answer your questions if you have any. Thank you so much, Mikhail, for this very, very detailed and informative and interesting presentation. Though this issue is quite complex and complicated, that you have managed to show in very much detail the stages of the monitoring and the recommendations, and also to identify the gaps in the countries. So it's notable that during the monitoring, we actually covered 6 countries, And I think that's quite an impressive number of countries. And colleagues, I'm just using this chance to address what people are writing in the chat, because many people are asking if the presentations or the recording of the meeting will be available. Yes, of course, we will make all this available, the presentations and the recordings in all the three languages, so no worries, you will be getting access to these materials. And now I want to open the Q&A session. Please raise your hands, ask questions, and also countries that participated in the monitoring. I'm now addressing you. Maybe you could jump in, comment, or share some extra details that were not presented during this presentation by Mikhail. I can see one hand raised. Please, who raised? Yes, please. Oh.
Thank you. Mikhail, thank you very much for a very helpful presentation and overview of what is happening. My question is about the funding of use of the standardized package. I had always hoped that by going down the line of standardized a package, it would be possible for CSOs to enter into normal contracts with the government for the provision of services rather than be dependent on grants or social control. Was that in virtually every country, the mechanism for funding remains social contracting rather than a regular, normal, year-by-year contract for the provision of given services. Have you seen any sign in any country of moving towards normal contracting rather than a CSO grants package?
Thank you very much for your question, Paul. That's a very good question. And I think I cannot even respond to it just immediately in the blink of the eye, because it needs to be studied further. But you're right. From what we see now in the countries, most of the countries primarily hugely use social contracting. Sometimes these contracts are subsidized, sub-invented, and I think this is due to the practices that have been there in the countries for quite a while. And the countries have not yet started thinking about using just ordinary routine contracting practices, though I really think that would be the right way to do it. And we need to start thinking about and implementing these practices. But because they have not yet studied it in detail, they don't have the data yet. And I think most of the gaps that I mentioned in my presentation, these gaps have been identified just now through our monitoring, and maybe after the countries know the gaps, they would revisit their practices. But you're right, this is something that needs to be studied further, to be discussed with the countries, because for all the countries, funding is one of the milestones, one of the very important elements to this program. And also there are, by the way, some sets of eligibility criteria so far for CSOs to be even eligible for social contracting. And for instance, organizations, civil society organizations that are not officially registered on the list of potential service providers with the government, they are not eligible at all. And this is a great idea, and I will try to pass this idea on to my colleagues so that they would study this question deeper. Thank you very much, and we have one comment in the chat from Natalia. Natalia, maybe you could just ask your question online here? Well, I would like to say that this evaluation has actually allowed us raising this question at all. I mean, this question of the standardized package of services to be funded and implemented by NGOs and CSOs. And as we conducting the interviews, as we distributed the questionnaire, I think that helped raise a lot of questions among the respondents, among the agencies that we surveyed. And again, also, it is a good wake-up call for the organizations that provide financial assistance and implementation assistance to the countries. And thank you very much for your evaluation, Mikhail. I think this is really one of the projects that helps institutionalize and strengthen the implementation programs at the country level. Thank you very much, Natalia. I can see one more hand raised. Olga, please, over to you. Thank you. I did not raise my hand after the first presentation because frankly speaking, I wanted to ask a question or a comment on both presentations altogether. First of all, thanks to TBEC for involving the community in the monitoring efforts, monitoring activities, we know that especially as we speak about the monitoring of community support services, this is of great interest for the communities themselves. I think Olga is having some problems with her internet connection because her voice is strongly interrupting. And again, from our experience, from our studies, we know that this topic of TB drug procurement is not well studied. The communities are not yet too familiar with it because maybe this topic, this issue is somewhat closed for the community. I mean TB community, because for instance, we speak about the HIV communities. There has been several years advocacy to make the procurement transparent for HIV, but it's different for TB. So the TB communities have just started conducting this kind of monitoring, and now they have a lot of questions. They have pinpointed some gaps and now are starting to think how they could fill in these gaps. And also farmers who actually demand some implementation, they also need to have a very strong policy for ensuring sustainability of these services after the graduation of the funding, unless of course countries have some emergencies like war or a pandemic or something that goes beyond control of a single individual country. Because unfortunately today the accountability of donors is not well regulated, not in the context of obligations or commitments, but in the context of excess, I would say. They really have very soft accountability requirements, I would. And I want to thank Mikhail for the award because it was really very interesting,
and the capacity of the community in terms of monitoring will get strengthened.
And it's also very important how the situation changes after this, actually based on your recommendations. And it's very important that you recommend training for the communities, because we need to raise the awareness and competencies of these communities. So thank you. Thank to both speakers.
Thanks a lot, Oля. Thanks for your comment. Bakyt, the floor is yours. Thank you very much, Jack Alex. Thanks, Mikhail, for the great presentation. Bakyt, I'm sorry, could you please move the microphone? Yeah, sorry, I forgot about it. Yes, thank you very much, Mikhail, for your great presentation. And, well, the standards are good, but it's important for us to aim those at the key points. I think that the preventive treatment is not working. Probably we don't find the contacts, because when the state makes the social contract, it is focused on some particular points. And I would like to add to my presentation, because while I was presenting and then we were listening, we have information. We just got it on the 22nd November. Well, the decree was made by our government regulating the procurement of medications through UN agencies and UN programs. So it happened just 6 days ago, and now it's an available mechanism. Also, I would like to share a good news that in our country now bedaquiline has got market authorization, and the combination of the medicines from Janssen and rifampicin isoniazid, and isoniazid are now registered by the MacLeod's company. I will yet add it to the final report. That's the data I have just received from my colleagues. Okay, thank you. Mikhail, would you like to add something? Yes, thank you very much, Bakyt. Maybe it is the most sort of acute moment, painful thing. If you look at the services that have not been included, then the support in providing preventive treatment of tuberculosis was something that was excluded or not included by all the countries in this supportive service package, except for Tajikistan. But as far as we understand, they also don't have it yet. It's difficult to say why it happens like this, but there were comments that clinicists consider that this is a clinical task. We generally disagree with it, but probably that's a general question, because so far we have not yet switched to the understanding that the prevention work, a preventive cascade of TB response is going to be increasingly more important in our countries. While we move towards elimination of the TB problem, because sort of scaling up the screening programs and involving people in preventive treatment, we know that in many countries adult contacts get no preventive treatment, and the main focus is on children. And we also know that there are problems with stigma and misunderstanding. People mistrust something. So we have a lot to work on, and our first recommendation is to standardize the package, and we urge all the countries to implement all the services that were recommended in the national packages. Thank you very much, dear colleagues, for your active discussion and for your questions. And we had one more comment in the chat about the fact that to scale up such interventions and to improve access to those who need it the most, it is important to have documentation and cross-learning, like sharing the experience. If you don't have other questions, because I don't see the questions in the chat, then we can switch to further to the next presentation and to continue the topic of the standardized package. TBEC, as Mikhail has said, together with the PASS Center and the WHO Europe Regional Office, with the financial support from the Stop TB Partnership, have developed an online course on the standardized package. And the communication manager of TBEC, Aleksandra Vasylenko, will share more information about it. Thank you very much, Alessia. It's a great opportunity to present to you this online course on the standardized package of community-based support services. As has already been said by Alessia and Mikhail, this course has been developed to help people to get a better understanding of the 12 services included in the standardized package. This online course allows you to get well presented, visually presented information about all these services and the methodology of calculations and get the necessary related skills. Next slide, please. This slide has been developed by TBEC with the financial support of Stop TB Partnership, WHO Regional Office for Europe, and the PASS Center. Next slide, please. This online course is the basic preparation for basic training for CBOs and CSOs on how to provide the services included in the standardized package. Let me remind you that the standardized package has been developed by the Europe Coalition and PASS Center 3 years ago, and the main goal is to complement the medical services on TB treatment to ensure more comprehensive and uninterrupted provision of care. And this is all, of course, the purpose of it is to improve the results of treatment of tuberculosis for all people, including the most vulnerable populations. And it is, well, thought that to standardize the quality, to improve the quality, this training course will become mandatory for CSOs and CBOs. For the personnel involved in provision of services through the social contracting. Next slide, please. For several months already, the online course is available at the openwho.org. You see the QR code, you can use it to get to this platform. I also would like to ask the colleagues to post the link to this platform in the chat because we will return to it a few more times. Next slide, please. Currently, the online course is available only in English language. But in the next year, it will be available in Russian as well, thanks to the support of the WHO Regional Office for Europe. And as soon as it happens, we will, of course, announce that. The structure of the online course is 13 modules, for each of the 12 support services, and the methodology for their calculation. You can take those modules separately, regardless of the rest, and choose the topics that are of the highest relevance for your practical activities. Every module, every topic has been developed by experts with extensive experience in the field of TB response. Those experts represent the communities and the civil society, NTP, WHO representatives, and the experts also included doctors and personnel of international organizations. It is necessary to make a quick free registration to have access to all the courses available through this platform. Soon we will see how easy it is to get registered. And of course, it is all free, as I've said. Next slide, please. I will not go into much detail, we'll just listing these topics, but in my presentation there will be hyperlinks to all the 13 modules of the course, and when you get the presentation after this meeting, you will be able to choose those topics that are of the biggest interest to you and actually see the module that you wanted. For that, of course, you need to get registered. As I have already said, the specifics of this course is that you can take the modules that are of the biggest interest for you. Some you can just discard, and after each module, there will be a test, and you can get a certificate on this particular topic. Next slide, please. The structure of each module is different, and all the modules in this course, they include videos, including the video introduction from the expert who developed this course, and the lectures as presentations and short animations, as well as a lot of interactive materials and tests where you can check how well you have understood and remembered whatever knowledge was given to you, and to check your progress. And after each module, there is a number of links to useful resources. Next slide, please. As I have already said, after completing each of the 13 modules, you can get a WHO certificate about getting trained on this course. The only condition here is correct answers to more than 80% of questions of the final test for each module. Next slide, please. Now I'm going to briefly show you how you can get registered on this platform. For those who have already got registered, maybe it will be interesting for them to see how they can access the course they need. If you want to do it in parallel with me actually showing it, try doing that, because it's very quick and simple, but we will not have time to stop and help you if something goes wrong. But if you have any problems with the registration later, you can contact us after this meeting. You know our contact data, and we can help you well understand what's wrong and help you to deal with it. This of course, there is the instruction of how to do it. You get it after our meeting. First, you enter the platform. You see the QR code, right? You use it to access the platform. And well, you can either sign up or log in, yes, if you already have an account here. Next slide, please. Now, that's a very simple registration, just 4 steps. That's you just need to include your name, email address, and password 2 times. After you complete it, next slide, please. After sending this form, you will get a notification on your email, where you need to confirm that this is indeed your email. You get to your email account, and please know that quite often the letters from the emails from this platform get into the spam folder. So if you don't get it immediately, check in the spam. The next slide, please. And after you confirm your email, you can access the platform itself and your account within it. That's the step 8. You can add a lot of details about yourself that will help the system to provide you with some relevant courses, to suggest some things that will be of interest to you. You can provide the very basic information, of course, but it is mandatory to indicate your professional activity, your occupation, and it's not professional affiliation. Sorry, it's easy to do that. You can just check it. Next slide. After you get to the platform, there will be a small filter on top, which will help you to choose the courses, well, depending on the language, on your training level, and on the keywords or topics. Here you see I used the keyword of tuberculosis. There are many different courses, including 13 independent modules that are part of our online course on the standardized package of supportive services. The second arrow shows them. Next slide, please. And well, you see how this course looks inside, and here you can see the detailed content of this course and some links to other relevant courses. And here you see two options of how you can sign up for this online course. You press any of those buttons and get another email of having been signed up. Next slide, please. And here I have opened, for example, the first topic of the standardized online course. All our modules are unified, and what you see on the screen, this style and visualization of our course. Let me tell you, all the characters you will see in here, they have been on purposely drawn based on the faces of the experts who developed this module. So maybe even without the name, you may recognize our colleagues. So here you see the up top and side panels. You can watch in normal sequence all the content. You can watch it chaotically, but well, it's a good idea to follow the natural sequence, of course. But this way you can have misunderstood something, or you don't remember something, you would like to refresh it in your mind. You can return to any part of the module, and in the end there will be the final test that will allow you to answer questions and get the certificate for this module. Next slide, please. As I have already said, in every module the content is very diverse, and we try to make it so that taking it would be not just useful in terms of getting the necessary information, but also not too overwhelming, so it would be easy to understand and to perceive. I hope that you will enjoy it, and one day you will be able to provide some feedback about how were these modules for you, how did you like this online course. And if you have any questions, please contact us, because we are looking forward to getting the Russian version of this course, and of course we will share this good news with you as soon as we get it in 2025. Next slide, please. And thank you for your time and for your attention. And one more QR code. If you have not joined us and you want to do it, please join this coalition through our website.
Please fill in a brief form that will give you a better access to our materials, our info, and to strengthening our efforts for combating TB. That's it. Thank you. Thank you, Alexandra, for detailing all the stages of how to get registered, how to get access to this platform and the course, for sharing the algorithm. In addition, I would just say that our team, I mean, the entire team that worked on developing this course wanted to really use very simple language to explain things so that it would be easier to memorize, to understand, and all the participants who want to register can choose the pace of this course, the timing of the course that is more comfortable for you. Because the course has no time limitations. And as Alexander mentioned before, it's not necessary to choose all the 13 modules. You just choose the modules in the sequence that you prefer. And again, our last Q&A session. Please, colleagues, if you have any questions, maybe clarifying questions on this training course in general, on the content of the course, Please, it's your time now. Well, I don't see any raised hands, so no questions. So maybe because Aleksandra really presented the course in so many detail. Again, dear colleagues, if you don't have questions now, please remember that we are ready to take your questions after this meeting as well. You can always email or message us. And once again, after this meeting, we'll be sharing all the presentations and the recordings in the English, Russian, and Ukrainian language. And just, I want to thank all the participants for finding time to participate in this call, participate in the discussion, ask questions. I want to thank all the presenters who shared their expert knowledge and prepared really well-structured and informative presentations. And of course, huge thanks to our interpreters, because without them, we would not be able to understand each other over these two meetings of this meeting. So thank you for your interpretation. And once again, traditionally, I'm repeating that all together, we will be able to stop TB. So have a nice evening or afternoon and see you in the future. Thank you. Thanks to all the organizers, the participants. Thank you and see you. Bye-bye.